Hello, guys. Today's topic is Psychoneuroimmunology and Psychoncology. The first question is: what is Psychoneuroimmunology? It is an interdisciplinary field that studies the complex interactions between the nervous systems, the endocrine systems, and the immune systems, and how these interactions influence the health and well-being of the individual. Second, where does psychoneuroimmunology come from? The term psychoneuroimmunology is derived from three main areas of study: psycho, neuro, immunology. Psycho refers to the mind, psychology, and emotions. Neuro refers to the nervous systems and its function. Immunology relates to the immune systems, which protects the body against infections and disease. What areas does it encompass? It encompasses a wide range of areas of study and scientific disciplines. Some of the main disciplines involved in P, P, PNI are the following. First,
Having defined psychoneuroimmunology, now we are going to see the evolution of it through time. It started as a scientific field. In the 1970s, the psychologist Robert Adler was the person who invented the term. But this scientific branch has been studied since the beginning of the 20th century. In the course of the years, since 1940, some psychosomatic observations were made regarding emotional factors in the onset and course of autoimmune diseases, mainly rheumatoid arthritis, including systemic lupus erythematosus, Graves' diseases, type thyroiditis, and others. Perhaps the most intriguing observation from this period was that physically healthy relatives of patients with rheumatoid arthritis had in their serology the characteristics of the rheumatoid factor antibody, the anti-immunoglobulin G, but with higher psychological adaptation than those without the factor, suggesting that psychological well-being could have a protective influence in the face of genetic vulnerability. Now that we know when it started, in approximately 1940, I'm going to explain the process that introduced psychoneuroimmunology to the scientific field. In the late 1950s and early 1960s, animal experiments implied that the stress could affect both humoral and cellular immunities. Rasmussen, Marsh, and Brill found that mice exposed to stress were most susceptible to contracting herpes simplex virus infection. Wistar and Haldeman found that the same intention prolonged autograph retention. The first direct experimental evidence for the effects of stress on immunity was the reduction in antibody response to an antigen as a result of stress in rodents, was provided by BC and Solomon. Around that time, Solomon, also with Levine and Kraft, demonstrated that early life experience could affect the antibody response in early life. The critical link between the immune system and the brain in the neuroendocrine immune axis was convincingly demonstrated by Besedov and Sorkin in the 1970s. They show that immune activation triggers the hypothalamic pituitary adrenal axis in a role of immunology. There have been many contributions through the time, but now, how's it going at this moment? Now we see that there are studies with depression and also anxiety, not only with stress. There have been many studies, and at this moment are being many more. Now, Ariana is going to present you two cases that psychoneuroimmunology studies.
Okay, now that we know about what psychoneuroimmunology is and its history, we can talk about its findings and contributions to the psychology. This field has become really important, so it has many studies, and we could say that the one that englobes everything, like the phrase, the study that resumes all of them, is that they have studied the relationship between behavioral components and immunological illnesses. So they are talking about the mind and body. What is the relationship? Using the immunological system as the way to connect them. They also have studied the influence of stress on immunity, the emotions in general, how they affect the immune system, the psychoactive substances on immunity, and also they have distinguished the individual psychological differences in immunity. Finally, this field also has some studies about the regions of the brain and its relationship with the immune system and the emotions. Okay, everything with the has to be related with the emotions. Now, knowing this, we are going to talk about some psychological cases where they use the psychoneuroimmunology and where they don't use it. This first case is where they don't use it. Okay, this case is about a doctor who has been working all day. She has many patients and she is at a public hospital. So she doesn't have a schedule or a determinate time for each patient. Now she has a new patient and she just started to ask many questions. And well, the doctor notices some strange symptoms, some red flags, and also the patient that he has a very strange illness. This patient, was evidently shocked and he started to overthink about the situation and panic because the doctor didn't care about his emotions. Now, in the second case, that is where they use the psychoneuroimmunology, we're talking about a psychologist and a specialist in psychoneuroimmunology, and she is at a private clinic, so she has time for each patient. She can take her time to evaluate each of them, each case. Now she has got a patient, and she started to ask some questions. She started to ask to know the patient and to know the situation. She started to connect with him, and the patient didn't remember exactly when he started to feel the pain, no? The thing that he is feeling. And well, he started to remember with the psychologist, and the psychologist started to connect with her patient, caring about his emotions, about his thinking. So they step by step got to the answer where or when he started to feel bad. And the patient was very comfortable with that because he was the one that did the job, but with the guide of the psychologist. Now that we know a little bit more about the psychoneuroimmunology, a new field in the psychology, we are going to talk about psycho-oncology, also a really important field.
What does it consist of? The primary goal of psychonology is to promote parents' quality of life in the help them cope with the emotional, social, and psychological changes associated with cancer. Psychologists work closely with medical teams to promote comprehensive care to parents. Some of the areas they focus on include psychological evaluation. Psychologists evaluate the emotional and psychological impact of cancer diagnostic and determination on variants. This involves identifying and managing issues as anxiety, depression, stress, fear, and distress. 2. Emotional support. They provide emotional support to parents and their families through the cancer process. This may include developing coping stress, promoting open communication, and conflict resolution with the family, and helping to deal with uncertainty and grief. 3. Individual and family therapy. Psychologists offer individual and family therapy to help parents cope with change in their lives, improve their emotional well-being, and strengthen family relationships. Mm. 4. Crisis intervention. Preside crisis intervention and the immediate support in difficult situations, such as serious diagnosis, relapse, or difficult treatment decisions. 5. Education and counseling. Provide information and education about cancer in the treatments and side effects, and help parents make informed decisions about their healthcare. 6. Promotion of self-care. Psychoncologists work with parents to promote self-care and general well-being. This may include stress management, stress reduction techniques, physical exercise, and promotion of healthy habits. Psychology recognizes the importance of addressing both the psychical and emotional aspects of cancer, recognizing that psychical well-being can have a significant impact on parents' quality of life in the treatment outcomes. Importance of psycho-oncology. Psychoncology plays a crucial role in the comprehensive care of people facing cancer. Here are some aspects that help them the importance of psychology. 1. Emotional well-being. 2. Adaptation to change. 3. Quality of life. 4. Support for the family and caregivers. 5. Informed decision making. 6. Survival and adherence to treatment. In summary, psychology is essential to address the emotional and psychological impact of cancer on parents and their families, improving their well-being and quality of life at the aspects of the cancer process.